So welcome everybody to this future-proofing initiative, which is focusing on this theme of today, which is building resilient healthcare systems. And this has been an issue that the European Alliance for Personalised Medicine, as well as many organizations, has been focusing on over the last years. The future-proofing initiative is a multi-stakeholder initiative, bringing together different types of stakeholders. The patient organizations, from different disease areas, medical and research organizations from, again, different diseases, and also industry, as well as policymakers, to support a common framework. How do we tackle bringing better healthcare into healthcare systems? And this has been a big challenge as we see, taking account COVID-19. And the question is, how do we build resilient healthcare systems? It's not to say that healthcare systems have not been resilient. The issue is that a lot of work has been done to build resilient healthcare systems. The question is, how can systems react better, taking account challenges that are taking place, such as COVID-19, which is a more recent challenge. Of course, we have different epidemics in the past, but also how do healthcare systems adapt when we look at new types of innovation that are coming into the healthcare systems. And that has been a challenge that the Future Proofing Initiative has looked at. It's looked at presenting and developing different indexes in the area, and has also seen how can we drive forward this type of innovation. And this has been a question that we're tackling. If you look at the term resilient, how can healthcare systems able to withstand different challenges, but also recover quickly? And COVID-19 has brought out these different challenges to the fore, as same as the economic crisis in 2008, and brought out challenges to the financial system in terms of the economic challenges it had to face. The same stress testing has occurred for all healthcare systems. And all healthcare systems have reacted in different ways. Of course, governments and the broader community in the healthcare sector want the best standard of care for the patient. But the question is how to do this. And if we compare the healthcare systems as a boat or a ship in a harbour, of course, healthcare systems had maintained trying to treat patients in the traditional way that they had treated patients. And a ship in a harbour, of course, is not the most natural place for a ship. A ship in a harbour, if you compare it to a healthcare system, a ship in a harbour, when it goes out, a natural place for a ship is to go out into the sea. And there is the most natural place for it. But of course, in the sea, as with a healthcare system, there will be storms. And these are the challenges that we are facing. And there is a perfect storm in terms of the challenges healthcare systems are tackling. And one is, of course, this pandemic, which is respiratory related, but also you could have different types of pandemics. 1 in 3 people in Europe get cancer each year. So this is per se a pandemic of a sort. The question is, how can we tackle this? There's a great burden for diabetes patients and other types of patients. And the question is, how can we develop a framework to tackle this collectively together? Of course, Europe, which I will focus on, has different challenges it faces. And the other side of the pond, or the side of the globe, I should say, is Asia. And we will have a dialogue between Asia and Europe on the best practices we should take, and what are the challenges, and what were the reactions from different types of healthcare systems. And where can there be learning and sharing between different regions of the world to say, how can resources be better allocated to tackle these challenges? What are the standards that we should put in place to do this? How can there be more public and private collaboration between different types of stakeholders? And how can we empower the broader stakeholder community? And this has been in very much in the area of joining together the world of public health and personalized healthcare. In that often it's seen as a contradiction, population-based healthcare and personalizing healthcare, because when you look at the person, what is his specific reaction to specific diseases? But of course, when we understand science more and understand innovation more, We have a greater understanding of different diseases. So the broader population approach to tackling this area. And this very much needs a multi-stakeholder approach, a future-looking approach to say that how should we tackle this? Because disease, as with COVID-19, has no borders. Disease like cancer, like diabetes, as I mentioned, it has no borders. The question is, how can we, as a society, a global society, focus together and tackle these challenges to take a common approach? How can there be lessons learned from different regions, different countries, and saying what are the best practices that we should take? What is the role of the public sector? What is the role of the private sector to support this? And this is very much the role of this future-proofing initiative. And the focus then today is to focus on how can Asia and Europe see what are these best practices, as I mentioned. We have 2 sessions. One session will focus on lessons learned and what we can take from both regions. And this will be chaired by my co-chair, Jeremy Lim. So he has a difficult job synthesizing some of these key messages and key lessons learned. So I had a choice of the different sessions that I should take. So I give Jeremy the easier one. And then I will focus on the second, no problem. And I will focus on the second session on this issue of data and data empowerment, which is a real driver and a real game changer of the story. One, I would say the real changer is how can we empower citizens and trust citizens, and how can we trust the broader healthcare community by providing more information to the community, but also seeing how can different types of actors work in a more collaborative way. What is the role of different stakeholders, and how can we define value so that each stakeholder can get a benefit? Of course, researchers want to produce more research, scientists want to produce more science, patients want the best quality of care, governmental stakeholders want to ensure resources are a bit rationed, and also industry want to supply services and in terms of diagnostic therapy, so we can early diagnose, therapeutics, so we can treat, but also empower data. And the question is, what is the ecosystem to do this? So this is very much looking at what is the resilience, and the resilience, I would say, is the stakeholders, which we've brought together in future proofing, and then this dialogue with policymakers around this. So this is my opening remarks, and I will just pass the floor to Jeremy to give the introduction as well. Thank you, Jeremy.
Thank you, Denis. And if I can pull everything together, I think that COVID-19 has really demonstrated just how inadequate current systems are. And hence, I really would like to thank the organizers for bringing together such an important theme around future-proofing health systems, and the specific topic today, which is around resilience. And I would see resilience in really 2 dimensions. One is the ability to immediately respond to a crisis, an outbreak such as COVID-19. And the second is how then do we prepare for surge capacity as well as plan for this really recovery. And if we look at COVID-19 specifically, we are looking at a series of really unlockings and perhaps a bit of tightening, locking back, and then unlocking again. And this is where really data comes right into the forefront, because the world cannot tolerate another lockdown of this magnitude. We probably would have to live with a series of mini lockdowns separated by geography or by really severity. And data and the use of this data really helps to guide us. And as I look at our eminent panel today, it's really about learning, and I would say that there are lessons to be learned. There will continue to be lessons to be learned, and it's really going to be a very exciting dialogue between Asia as well as Europe, with very different cultural, with very different political systems. Maybe just to round off on my opening comments around data, we do want you, the audience out there, to be participating, and so please do log in the questions into the chat, and I promise you that we'll do our very best to make sure that they're all answered. We'll also be sprinkling polls throughout the throughout this webinar. So please do participate. Help us to understand what is the sentiment, not just amongst the panel, but amongst the almost 1,000 of you who have logged in. And finally, because this is 2020, we must have a hashtag, and the hashtag is hashtag FPHResilient. And so please do share thoughts and ideas on any or all of these platforms. So thank you very much for joining us. And can I hand the time back to Denis? Thank you.
Thank you, Jeremy. So it's my honor and my delight to introduce Brigitte Nolet, who's the General Manager for Roche in Belgium. I've known Brigitte for many years, and she's worked in non-profit organizations, she's worked in governmental areas, and now most recently she's worked in Roche. So she's worn many different hats. But from my interaction with Brigitte, I would say she's always put the patient at the center. How can we improve care, and how can we improve understanding between healthcare systems? So delighted that Brigitte will give the opening remarks to this session. So please, Brigitte.
Thank you, Denis, for those very kind words. And good morning or good afternoon to everyone, depending on where you're tuning in for this event. As Denis said, my name is Brigitte Nolet, and I'm the General Manager for Roche Pharmaceuticals here in Belgium. And it is such a pleasure to be with all of you online today. When we first started hearing about COVID-19, I don't think any one of us could have predicted how significantly our lives would change in the matter of months. And as a company, Roche is partnering with healthcare providers, laboratories, authorities, patient organizations, all of them, to support a local response. And we are committed to helping to make sure patients receive the tests, the treatment, ultimately the care that they need. Companies like Roche can be part of the solution. And as both of you have said, as our co-chairs, really the belief is that collaboration is essential in this conversation. Among the various challenges that this current crisis has brought to the forefront, it has raised a really important question, and one that is quite familiar to the personalized health community, one that you've both touched on. And that question is, how can we harness the power of data in our healthcare systems so that they are ready for the challenges of tomorrow? We've been through a lot in the past few months, and as you both rightly said, what are those lessons? And to answer this, it is important to build a broad coalition for change, one that maintains dialogue between stakeholders and that shares those best practices, those lessons across borders. And that's why we're here today, and it's a challenge that isn't going to end when the crisis is over. I'm really pleased. Today we're going to hear from experts across Europe and Asia, and I've already learned quite a bit just from your opening remarks. Despite the geographic distance between them, these experts, they are united in their aim to help the healthcare community advance health systems towards a sustainable, a more personalized, integrated, and digital future. The Future Proofing Healthcare Initiative, as it was explained, it brings together experts from around the globe to share data, evidence, and insights. We draw on the lessons of the recent past, and we look forward to the needs of the future, all while sharing those insights and those best practices from around the world. I'd like to thank the European Alliance for Personalised Medicine for its collaboration in putting together today's event. It's a really important conversation that's about to be had, and I'm really pleased that we could all partner together to advance the conversation. I'm looking forward to hearing from all of our panelists, as I'm sure every person registered is. And in closing, I just want to thank both of you, the co-chairs, for your efforts today, and all the panelists for sharing your perspectives. We're really looking forward to it. Thank you very much, and have a great session.
Thank you, Brigitte.
Should we move on to panel one then?
Jeremy, I will give you the easy task, so I will let you go first.
All right, thank you. All right, could we move to our panel discussion? Thank you. Yes, and we've got eminent speakers here, and the first panel will be on lessons learned about health systems preparedness and resilience. And before I introduce the panel, I would like to just make some very quick comments that as we discuss over the next couple of minutes, I would ask the panel to think about international cooperation, how the lessons in their own countries or the countries that they are familiar with can be applied to a much broader base. And secondly, can we also think about the role of data? Because as we think about how the world unlocks, it's going to be a combination of biology and of data and this notion of the digital phenotype that will allow us to unlock really much more quickly and much more safely, right? And the better we understand the behavior of the virus, we understand our own social behaviors that may contribute to spreading the disease or really lessening the spread. Share some thoughts around how your countries have been using data. And really finally, every time we talk about data, there will be concerns around privacy, and much more broadly, the real debate is really what is the role of governments and larger society in finding that balance between necessary public health interventions and the economic impact and the societal impact on individuals as well as families. How then do we strike this balance? Right. And the better we can understand individuals and families and their circumstances, the better we can shape a public health strategy that will be effective, but also minimize the unintended consequences, or in military terms, since many countries are saying we're fighting a war, how do we minimize collateral damage? And on our panel today, we've got 4 excellent panelists, and I'll introduce them in turn. Really, Mary, who is from Ireland, former Deputy PM and former Minister for the health, and we have Stanimir, who's from Bulgaria, chairman of the National Patients Organization, and then Professor Chunlin Jin, who is director of the Shanghai Health Development Research Center, and then finally Professor Tikki, who is a visiting professor from the Lee Kuan Yew School of Public Policy in Singapore, and Tikki is also a former director of the WHO of the World Health Organization, focusing on research policy. And without further ado, can I please welcome all our panelists, and I look forward to hearing thoughts from you. Maybe can I start with maybe Tikki? And because Tikki has traveled around the world and has so many countries, choose whichever country you want to take reference. But what do you see as the most obvious early lessons learned from your country's response? And then maybe we'll go with Tikki, Mary, Stanimir, and then Chunlin. Would that work for everybody?
Yes.
Thank you. Tikki, can we start with you?
Yes, thank you, Jeremy. I hope you can hear me. Good afternoon, everybody. I'm just quickly going to address this question that Jeremy posed, which is the most obvious early lessons, and based on my observation of what's happened in Singapore. I think there are 3 dimensions to this that is part of the Singapore story, if you like. Rapid response, anticipation, and a capacity to fight fires. And this is sort of based on 3 legs of a tripod. The first one is to have robust healthcare systems, the capacity to extensively and rapidly test, to trace, to isolate, to treat. And all of that, of course, is based on good data. And the Singapore government has invested a lot in that dimension of data. So that's the first leg of the tripod, a robust healthcare system. The second one is social capital. And you really need a population which trusts the government, which is happy to follow and be compliant to government directives without too much questioning or protesting about this is what we need to do. Okay, so that's probably unique to the Singapore context, but something we can talk about later. So that's the second leg, social capital. The third leg is good governance, and that's absolutely critical. Singapore established an interagency task force involving all the key line ministries. Most importantly, there was unity in purpose, the task force. There was no confusing or contradictory messages sent by the task force. And finally, it was free from any political interference. So I'll leave it at that. I think those are from my perspective, the early lessons from the Singapore experience. Just to finish, as many of you know, the capacity to fight fires has been tested very recently because of in a way, an unanticipated explosion of cases amongst the migrant worker population in Singapore. But once again, the government has been very quick to get a handle on the situation. So that's what I meant by anticipation and your capacity to fight fires. So back to you, Jeremy.
Yeah. Thank you, Tikki. And it's timely and it's really pertinent that you spoke about good governance and the absence of really politicization. And if we turn to Mary, because governments in most of our countries are essentially made up of politicians. And Mary, could you speak about the lessons that Ireland has learned and how do you juggle some of these tensions? Over to you, Mary.
Well, good morning, Jeremy from Dublin in Ireland. I agree with much of what Tikki has said. That's been the Irish experience. Firstly, the science and medical expertise was put before politics and the economy. And the government in Ireland acted very early based on that advice. And extraordinary for Ireland, the community have complied. We closed the schools, closed the businesses, people were put into social isolation, and there has been 99.9% compliance with that, and that is fantastic. I think it's very reassuring. Secondly, I would say the workforce in the healthcare system have shown great agility to adapt and work together. We had capacity issues we anticipated at the start, and huge national and community effort was put in place to resolve those issues, increase our capacity in ICU, etc. One of the challenges for Ireland, and indeed for many other countries, has been the weakness of our supply chain and the fact that at a regional level there's been no stockpiling or pandemic preparedness, and I think that's a lesson we have to learn. We need to work together. This virus has proved the interdependentness of all of us around the world, and as Brigitte said earlier, there are no borders when it comes to COVID-19, and we do need to work together. And lastly, I would say, by way of introductory comments, I think it has ignited the importance of data and the role of virtual care. Things that many of us have been trying to change for years in our healthcare systems, introduce telemedicine and virtual consultations. They're happening almost overnight, and I think that's been really positive because that has the capacity to improve healthcare outcomes, to improve prevention, and also to reduce the cost of healthcare. And it's been shown that by the World Health Economic Forum that 97% of the data in hospitals is never used, and that is a wasted resource. And I hope that one of the lessons that we learned from this is the importance of using data, presenting it in a usable fashion, and sharing it to the benefit of all our citizens.
Thank you, Mary. And I wanted to then now switch to Stanimir, and we have been talking at the macro level, but representing patients, what are some of the perspectives that really you would bring of what has been the lessons learned and how these have impacted patients? Yeah. And over to you, Stanimir.
Well, patients have been impacted a lot during this pandemic, especially patients with chronic diseases and patients who are not directly affected by the virus, but we were able to see clearly the link between infectious diseases, chronic diseases. This dividing for years have been there, and people wondering which one is more important. Shall we focus on non-communicable diseases that obviously are very important and causing lots of death around the world, or shall we continue investing in preparedness about infectious diseases? And at the end, we end up in a situation when I don't think anyone in the world was completely prepared for this outbreak, but actually the most affected ones are patients with chronic diseases with infection, because the highest mortality rates are among them. They were those groups where the weaknesses of the healthcare systems were obvious after and are still obvious during this epidemic, because we can see clearly where are the gaps in the systems to provide the care that the patients need, to provide the treatments that they need. And of course, from now on, I think the lessons should be learned, because we now see the situation. But I think for years we have to go back and learn our lessons and see what we have to change in the future. So it's not about being prepared on infections. It's not about being prepared on chronic disease. It's about prioritizing health as something that every government should recognize, not as just a cost, as many governments would say, but this is investment in the economy. This is investment in the future of our societies. But what's more, health is not something that any single country can handle alone. And these are probably the next lessons that were learned. Guidance, coordination, and solidarity. These are probably three key learnings that we have to analyze in the future, how we improved in that.
Yes. All right. Thank you, Stanimir. And can we turn over now to Chunlin? Right, and China was the first country to be affected in a large way, and has taken really heroic measures to contain the virus and the outbreaks. So maybe Chunlin, could you share some of the lessons that China has learned? Over to you. Thank you.
To share China's experience in fighting COVID-19 and its lessons, I think there are basically three lessons or experience that China would like to share. The first is that the country has all this time put its people's health, safety, and physical health first. The political leadership has mobilized all the people, and the top leadership has given top priority to it, and it has adopted a unified, centralized planning approach. We know that whenever a major public pandemic incident happens, it involves a very broad scope of the society, and centralized planning is critical in fighting the pandemic. Therefore, this is the experience we had in China. It leveraged its strength of its unique system and organized a centralized responsibility system to respond to COVID-19 as early as January the 11th. China shared with the whole world the gene sequencing of the virus to facilitate the early development of testing kits. On January the 23rd, the Wuhan city was decisively locked down to hinder the spread of the virus, and economic growth was given way to protect the health of its public. And the government mobilized the whole society and concentrated on the top priorities at that time in order to reduce the infection rate and the mortality rate, to get more people to be admitted into hospitals, to hospitalize. You know that we built facilities to centrally put all those infected patients in one place, so that they will not get more people exposed to the virus and infect more people in the public. This is the experience and the lesson we had, which basically is a centralized prevention and a centralized control in fighting the COVID-19. The second piece of experience we had is to intervene based on science. Basically, we achieved 4 early, that is early detection, early discovery, early reporting, early isolation, and early treatment. So through locking down the cities, the communities, and asking people to stay at home, we insisted that people must wear masks, and then we educated the public to wash hands, and we leveraged the strength of grid-based management of the communities to identify the infected patients as early as possible to prevent further spread. We also tried our best to improve testing abilities to shorten the time frame of a diagnosis to effectively block and prevent the further spread of COVID-19 and to reduce infection rates. We diagnosed them, we treated them, and we centrally hospitalized them. This proved to be useful, and here I would like to say that the testing ability and ability to develop medicines and treatment solutions or plans demonstrates a country's ability in science and technology. The third piece of experience and lesson we learned is that the country needs to ensure supply of medical services. In China, we centrally managed and treated the patients. We also centralized. We centrally managed all the resources, including all the medical resources like medical experts. We put all the more serious patients in hospitals that are the strongest, and we allocated the best resources and experts to those hospitals and provide these patients, those serious cases, with personalized treatment plans. During those months, across the country, altogether 42,000 medical staff went to Hubei province from other parts of the country to support them. The second question is, how should the countries fight against a pandemic like COVID-19? Should the countries collaborate, or should they do their own job in an isolated way? I believe that globalization, mutual collaboration is critical, that we are in a one world, and it is the important choice of path for all the politicians, all the political leaders in the world.
Thank you very much, Chunlin. And if I can turn us away from individual countries to start looking at international cooperation, and I think COVID-19 has really demonstrated the importance of international cooperation, but how difficult it really can be with accusations hurled in every possible direction. Maybe Mary, can I turn to you, and what is your advice for the world moving forward? What are some of the lessons we can learn from the evolving situation so that countries can work better together? Mary, over to you, please.
I think, Jeremy, we've become somewhat complacent after Ebola and SARS, and we probably felt in many parts of the world this couldn't happen to us, and therefore we weren't prepared. And I think the first lesson is we have to be prepared. We have to use technology and data to identify vulnerable groups. In an ideal world, I'd love to see us pool our medical expertise, our scientific expertise, to come forward more rapidly with solutions and vaccines and treatments, and I hope that is happening. I think there are positive signs. But essentially, during this pandemic, I think countries have been acting alone, and mainly because they were faced with a crisis, an unprecedented crisis. It hasn't happened in over a century, and they had no alternative but to act alone. So you had countries scrambling to get supply chain, protected equipment for their staff, for their healthcare staff, to get masks and ventilators, etc., etc. I hope that we can avoid that in the future by working together, whether it's through the WHO, that I think is doing a good job, or through the European Union. There's a lot of emphasis now on the European health data space. The Commission has produced plans so that we can share data. It is, I think, a hugely missed opportunity that we have so much data in our healthcare systems, and we're not able to use that to the benefit of patients to deliver better outcomes. And I think this is a wake-up call. This pandemic is a wake-up call for all of us, and I hope that we heed it. And if we do, I think our healthcare systems will be more resilient, more robust. Our workforce will work less in silos and more together, which they're doing at the moment in Ireland, which I think is quite remarkable. And the silver lining is that the kind of change that many people have sought for years and years will happen more quickly, I think, as a result of this pandemic.
All right. Thank you, Mary. And can I turn to Tikki? And I'll just pick on two words Mary mentioned. And she said, in an ideal world, and all these things would happen. And Tikki, from your time in the WHO and your observance of the current situation, what are some of the things that can bring us closer to this ideal world?
Well, first of all, I'm very happy to hear Mary's support for the WHO. Obviously, I'm not particularly objective. I still believe passionately in the role of the WHO. But let me begin by stating what David Nabarro said a couple of weeks last week, in fact. He is the WHO Special Envoy for COVID. And his message is very clear. Focus on the job to be done. Don't get distracted by all this blaming game polemic that's going on right now. Secondly, in terms of international cooperation, multilateral organizations, including WHO, I think it's sort of reaffirming, not so much identifying new roles, but reaffirming the original most important role, and that is to strengthen international solidarity on the basis of trust, on the basis of sharing, to collectively agree that the overall goal is to save humanity. In terms of new roles, and Mary's already alluded to that, and in terms of areas of activity, I'm particularly excited by the announcement on Monday, actually, a high-level announcement about the access to COVID-19 tools, the ACT Accelerator. Okay, that really is truly an international alliance led by the G20, WHO, the World Bank. And the aim here is to promote research into vaccines, diagnostics, and treatment, not just the development, but to ensure equitable distribution whenever these products become available. And at the end of it, I think that's the underlying value: health equity, health for all. And that's the value of international cooperation.
Yeah.
Back to you, Jeremy.
Tikki. And thank you. And maybe can I ask Chunlin a question around what has changed in China? And I'm approaching this from the angle that all of us say COVID-19 has changed our world, changed the way we work and the way we live. And as China has started to unlock, what are some of the changes that you have seen happening? Which ones do you think will be temporary, and which ones do you think will stay with China for the longer term? Over to you, Chunlin.
So should we cooperate or should we divide among the countries in the world? And I believe globalization, mutual cooperation, and global villages and communities are the important pathways for politicians and leaders in various countries to follow after this pandemic situation. Uh, in my view, this pandemic has clearly strengthened the global village concept. A country's priority, counter globalization, and the idea of being good at itself is all but low class, ridiculous idea, and that violates the basic laws of social development. It is the right way for all countries to strengthen cooperation, communication, and assisting each other. The world is a community of common destiny, a community of interests, and a community of fraternity. Only through mutual support can we bring out our respective comparative advantages and maximize our overall benefits. Thank you.
Yes, thank you very much. And before we turn to the audience questions, can I ask Stanimir, you had mentioned that during COVID-19 that patients with chronic disease were doubly hit in two ways. One, they were more susceptible to complications. Two, often their care, whether it was routine care or otherwise, it would have been delayed because of the emergencies, really nature of the situation. So moving forward, what would you like to see happen from the patient's point of view, and in particular patients with chronic conditions such as cancer or anything else?
Well, I think we have to see in the future much more coordinated actions, systems that are aligned properly, and patients having access to the same or similar quality of doctors, of knowledge, of interventions that need to be done. I think in the in this situation we saw different reactions from different countries, even everyday changes in certain specialty, even and the management of disease that can change overnight just because we have different signals and different publications coming from here and there. But what I would like to see in the future is a much more coordinated and approach between the countries,
Yes.
which should be synchronized to the latest scientific knowledge and what we have right now to offer to patients. But the other thing that I would like to see more is actually more digitalized systems where patients
Yes.
have access to their doctors and to the knowledge, not only to doctors, but using technologies could be the chance for us in the future, not only in pandemics, but in any healthcare issues that we have to tackle.
Thank you, Stanimir. And on this question around resilience, I am very struck by often people forgetting that the health system is not just about COVID-19, and that even in times of pandemic, life still has to go on. People still get heart attacks. They still need treatments for really cancer. And the graph that I think came from Reuters was very striking to me. Tikki, it was from your home country, Indonesia, and this graph showed that comparing the months of February and March, really Jakarta, the capital city, experienced 40% more funerals. And I wanted to ask Tikki and then Mary for your thoughts on how do we look at resilience from this angle? Because we had seen that many pediatricians, orthopedic surgeons were mobilized to fight COVID. But who's then going to look after routine vaccinations, childhood diseases? People still have hip fractures and all of these. Maybe Tikki first and then Mary?
Yes, very quickly. I think this is particularly relevant to countries where the healthcare systems are not so robust. Singapore obviously has great capacity to be much more resilient than Indonesia, the one you just mentioned. And in addition to what you mentioned about the increase in the number of funerals, I just got a message this morning from someone in our Ministry of Health. There's been a very significant increase in cases of tuberculosis at the same time, because many of our limited resources are being diverted to COVID. Singapore had a big increase, a surge in the number of dengue cases. So, this is really about resilience, preparedness, and robustness of the healthcare system in the longer term. To sort of, the overall message is not to have it diverted during a crisis, but to have a sort of a holistic, integrated approach towards universal healthcare. That really is the foundation for preparedness in the future. So I'll leave it at that.
Thank you.
Jeremy,
really, Mary, could you chime in?
Jeremy, this is a very relevant issue for a number of reasons. Firstly, we see in Nature magazine that a lot of clinical trials in other disease areas have ceased at the moment, and I think that is a great pity. In Ireland, like many countries, patients with other diseases are not going forward to hospital. Our hospitals have the capacity. Our oncology community in particular are very concerned about that because, of course, time is of the essence with diagnosing and treating cancer. And the reason they're not going forward is the fear of picking up the virus, because our hospitals are not overwhelmed in Ireland. We had anticipated they would, but in fact they're not. And there's a lot of spare capacity, and our health authorities and our government are urging people to come forward, go and contact their local family doctor, come forward if they fear they have any suspected cancers or lumps or whatever. And I think that's a message we have to get across. And can I also say, I think we're learning a lot from this virus in in how politics reacts. Very often in many of our countries, politics comes before evidence and comes before the right decision in many cases. And in this situation, in Ireland and many countries, the evidence and the science has come first. And I hope that that's going to last, because that's the only way we will get appropriate healthcare and good outcomes for our citizens. And I do hope that when a vaccine is available, that it's available to everyone around the world and not just the better off. And that's really something that I think is very important for all of us, that access to a vaccine, when it becomes available, is universal and not for the privileged.
Yeah. Thank you, Mary. And because we are all healthcare professionals and the patients should rightly be at the heart of all we do, with the 1 minute that I have left, I'm going to ask really Stanimir to have the last word. In terms of international cooperation, right? We have seen, and I'll be very candid here, the politicians have not really stepped up to the challenge to grow international cooperation. What would you as a representative of patient organizations like to see happen, and what can you do about it? Over to you, Stanimir.
Well, I think that talking from European perspective, it's clear that European Union cannot continue ignoring health and excusing not taking actions on health just because it is competence of the member states. Obviously, the competence of the member states is not enough to tackle such global issues as the pandemic. And here we can see the pandemic just because it's rolling out really fast and we see people dying in the centers of the big capitals. But how about people who are dying every day from, let's say, obesity, from cardio diseases, etc.? Why do governments ignore that? Why don't we take the proper actions on these issues? And I think the biggest lesson for us is that in Europe we cannot continue anymore like this, to really put everything aside on the governments, to put it under the carpet, and to rely that every single government would do the best for their citizens. It's not about sometimes even willingness of those governments, but it's about knowledge, it's about resources, it's about also size of a country, because we can see more and more disparities between bigger and smaller. So we have to see much more coordination, and Europe has to take the next step towards better prioritizing health on European level, not necessarily changing the treaty or something, but Europeans do expect results from this cooperation.
All right, thank you. And I must thank our 4 wonderful panelists. We have unfortunately run out of time and we cannot address all of the questions. But to the 4 of you, thank you very much on behalf of the organizers. It's been a wonderful session. Thank you.
Thank you.
Thank you.